That was probably a godsend. This is one of the best hospitals. I've only been in the two hospitals before, but this one here is absolutely fantastic. I can't imagine getting this particular care in the United States. Absolutely not. From the very person that comes in and cleans the room, person comes in and gives you your medicine, the students that are here, there's an ethic of care I have not seen, even when I visited people in hospitals in the United States. Okay, my name is Archie Wortham. I'm from the United States, from Texas. My principal doctor was Dr. Thomas George. We were on vacation here, and fortunately, after several instances of illness, we wound up in this particular hospital. That was probably a godsend. This is one of the best hospitals. I've only been in the two hospitals before, but this one here is absolutely fantastic. If there's one word that I would use to basically talk about this particular hospital, is the attitude. And the attitude of the person kind of generates, I guess, from a person who's sort of been my principal doctor, which is Dr. Thomas George. It's been fantastic. There is a Hippocratic oath of do no harm, and that's exactly what this particular hospital deals with. Whether it's the person coming to clean the room, as opposed to the person who's handling you in admissions, the internal treatment unit, or the intensive care. I had no idea the ramifications of some of my particular illnesses, but they were here in a very interdisciplinary manner. They didn't sit there and just one doctor says, well, this is what I think, and went back to his particular room. There was a whole cluster of doctors around asking back and forth, very, very sensitive not only to my particular needs, but also need to my family member, my bystander. One of the things that this hospital kind of reminds me of, previously I was in the military, and we had something called APOC, which was a assess, plan, implement, and evaluate. And that's one of the things that this particular hospital has done consistently. From the very moment there were the cluster of doctors who were trying to assess exactly what was going on with me. And once they discussed that, not only with each other, and they discussed it with me, then they came up with a particular plan. How are we going to handle this? How are we going to make sure that the patient's needs are met? And he particularly gets the whole idea of the feeling of being taken care of. And after planning that, they would implement, do whatever they needed to do. In some cases, there was a couple of procedures that neither one of us had, my wife nor I, expected that we'd have to go through. And then they would evaluate after they implement that particular plan. And it's a continual cycle since I've been here. Been here over 6 days, and I have not felt uncared for from the standpoint of unloved. You know, they would come and ask every day, exactly how do you feel? Is there anything that we can do for you? And it goes back to one of the initial things that I talked about, was the whole idea concerning attitude. Also, one of the things that I think this particular hospital does is something called, they go from an idea of, I use the term PMS, not to be used incorrectly, but they want to know how you are physically. Then from that particular idea, it says, well, what are you doing to evaluate yourself, to conquer whatever it is that you need, whatever they can wind up doing. And then the last thing is the spiritual aspect. We even had a minister to come by to make sure that things are okay, that I was in a good place, and that I felt that I was on the way to recovery, which I feel I am. I can't imagine getting this particular care in the United States. Absolutely not. You are, like I said, from the very person that comes in and cleans the room, person comes in and gives you your medicine, the students that are here, there's an ethic of care I have not seen, even when I visited people in hospitals in the United States.